Welcome to Simple Conversations, the podcast that connects humanity and helps us all learn new perspectives to living a full life. My name is Inshira Ado, and this episode is the second of a series, talking to people who risk their lives on a daily basis to fight COVID-19 and to give us a sense of what life is like living in the front line.
My name is Kwame, and I'm an IT entrepreneur and a social activist.
My name is Ikia, and I'm a nurse who's been in the gynae ward for over 7 years.
Thank you very much, and welcome to Simple Conversations.
Thank you.
Let me share the connection between Ikwa and Kwame. They're a married couple, and they have a son. And Ikwa is a nurse, which means that in this period where we're all fighting to get rid of COVID-19 or limit its spread and eventually see the back of it, she goes to work every day. And as a matter of fact, we've just caught her at the end of a 12-hour shift. And it's no mean feat. But let me start by asking, what is the mood like in your home?
Well, in the house, everybody is home. Nobody goes anywhere. So I'm the one who goes to work every day and comes back. So everybody is like, take care of yourself. Some people wish, some of the members in my house wish I wouldn't have to go to work. They even want me to resign if I could. But well, it's a job I've taken on. And I know that I've been called because looking at some of the things I've gone through, I could have easily stopped somewhere along the line. But I've been here for 8 years and I'm still going on, trying to move forward in my profession. So I feel I've been called. So I'm trying my best.
And that's all we can expect of you. Kwame, so what's it like for you? Do you see the mood same way Ekwa does?
Well, for me personally, because I also have a fair idea of the risks involved, it's also one where we sort of look at it as her going on her daily work. We are trying to be very optimistic and hope that in the course of it, she is not going to be exposed unduly to anything that is going to harm her health, because she is very central to the household in everything she does. So we depend on her a lot, and we just try to, we are upbeat and we are hopeful that at least nothing significantly wrong would happen, and we are trying to keep our spirits that way for now.
How are you doing that? How are you keeping your spirits up? What do you tell yourself, or what do you do that on a regular basis keeps your hopes alive and your expectations high?
Well, we still talk and laugh and joke and share funny aspects of her work day. At least those things remove or put the stress at the back of our minds. I mean, in the house, we just try to make sure that we don't have depressing stories to share, rather fun or encouraging stories. We go to social media, we try to watch a few movies that are interesting. I mean, today, for example, I played with our son the whole day, and when she came back, I told her about the adventures that he's been having, the kinds of things that we want to do. So things that just keep us in good spirits is what we are trying to focus on at the moment.
That sounds very interesting. And, this is something you've done by choice, or that's the default at home? Pre-COVID, would you have done the things you're doing?
Oh, the two of us, okay, we do that quite a lot. I have a lot of stories for work I can share. Some I can share with him, some I can't. So we've been like that. We talk about work, we talk about everything else. We are a couple who talk a lot. So pre-COVID, yes, would have done the same thing. But now that we are in the middle of a crisis, we try to dwell more on positive things.
Mm-hmm. Now, you chose to dwell on positive things. What what would trading conversations around otherwise not so positive things would do to you? What would it have done?
So one of the negatives is that I usually am online trying to check what is happening with the COVID around the world.
Mm-hmm.
So today I came back, and then once I opened the app, I was telling him that he should look. Right now, the US death has spiked to about more than 10,000.
Mm-hmm.
And looking at how ready they are, even the UK that has about 15,000 ventilators,
Mm-hmm.
their death toll is around 5,000 now.
Mm-hmm.
We don't even have 300. So if I'm thinking of that, then I'll start thinking, because I know that we are not ready. So once we start dwelling on the negatives, then you know that it's not going to end well, because he takes interest in my job. So we talk about it a lot, and I try to explain things to him, and he understands. So if we want to look at the negative side of what is happening, we will end up not having a good night.
Mm. Mm.
Yeah. So
Okay.
we don't think about it. Yeah.
Right. But that's when you're at home. That's how you've
Yeah.
developed a system to deal with your own psychological health and emotions around these times when you're home. Do you have a
Exactly.
mechanism that you use when you go to work?
When I go to work, I don't know. I take it like an hour at a time, because if you start thinking about that at work too, it means that you're not going to give the best of care to your patients.
Okay.
Because in suspecting everyone that comes, you are not giving out your best.
Mm.
So you protect yourself, you leave the rest to God, and then you do what you can.
Okay. I'm tempted to ask that, how do you how are you able to detach yourself from the fear of the unknown, the potential risk that's out there, and
Eh,
just carry on and work as normal?
that is why I can beat my chest and say I think I've been called. It comes naturally.
So in all this calling, Kwame, you've spent time with a young man at home. Of course, the statistics all around the world. You're a man that's got your fingers on the pulse, and you know what's happening. Especially in areas where, unfortunately, quite a number of health professionals are exposed. And how does it make you feel when you put us on a scale with, say, Spain, and people who are in your wife's profession are exposed? And
I obviously, if you follow me on social media, I am one of those who have been extremely concerned, to the extent that people actually accuse me of spreading fear and panic. And because of what I have seen, I am someone who is very hands-on when it comes to her. There are lots of days where I even sometimes spend hours with her at her ward, and she'll tell you that. There are times when if I go out late and I'm going back home, instead of going home, I sometimes sit by her at the ward when she's on night duty. I've seen a lot when it comes to, how healthcare is managed. And whilst it is not the best, you can also see that everybody is trying to do their best with the little that they've got in terms of facilities, in terms of resources. And looking at the statistics and all, this particular week, is the calm before the storm. And you need to dig down into your best reserves of hope and pray that the storm, when it does begin to hit, will be slightly merciful on us and not be like what we have seen recently in Western Europe and currently in the United States. So with that kind of approach, we are just looking at it like, okay, everything should just be like another day at work, or maybe at peak period in work when she probably has a lot more people to deal with. That is how we are psyching ourselves to deal with it. In Personally, as a family, we've invested in a few resources for protection, and if the time comes and she feels the normal work uniform is not enough, we will use what we have bought for protection, so that she can still discharge her duties, and be assured that at least when it comes to prevention, she's also keeping herself protected enough.
Mhm. So what are the trade-offs? You both are chatty and you get along very well. You like similar things. But are there any trade-offs in these times? Are you finding things that you ordinarily would have done that maybe now you don't do very often?
Oh no, I think we do the same things.
You probably just don't go out.
And yeah, so we can't go out because we are all supposed to be in lockdown.
Mm-hmm.
Yeah, we are spending more time. We are spending a lot of time in the house, a lot more time with our son. He's telling us things that we never knew.
Yeah, like yesterday he was telling me the story of Chucky, how Chucky came about. And 1988 movie, I had to watch it, and everything he said was true. I couldn't believe it.
And where did he see Chucky?
He was giving me something, some
said he watched
excuse.
something on YouTube,
and then it was there. Well, I didn't believe him, but then I told him that he'd been here before.
That's good. So there's a silver lining in all of this for you. Would you say that this is what has been your trump card in all of this? What's been the advantage for you in being able to mentally switch on and be cautious, but also live life as normally as you would have pre-COVID?
Oh, for me, I have a big advantage because it means that he hasn't traveled in the last 3 months,
Okay.
4 months, yeah. So he's here with me every time, so I can get to him any time of the day I want to. Because pre-COVID, like he's around the whole place every time, but for now I have him here every time. So.
Okay. All right. That's nice. Kwame, your work takes you around the world quite a lot.
Yeah, I travel quite a
lot. Do you miss traveling?
Actually, I should have had about 3 trips out by now, each totaling at least 2 weeks or so.
Mm-hmm.
It's not the traveling that I miss so much as the fact that my business is also suffering. So, but then you see, I'm not the only one. Everybody else is facing the same situation if you're an entrepreneur. So I mean, the loss of business is a headache that you want to put ahead till post-COVID when everybody else is going to try and recover.
Mm-hmm.
So yeah, you have to adjust by staying home and saving money, and then spending all the time probably with a child, or having family conversations, because our household is such that there are others apart from just us, the nuclear family.
Okay.
So we are getting to chat a lot more, joke about stuff. We are all in this together, so we find funny things to laugh about, watch movies and discuss them. So it's basically kind of like we're having a long throwback Thursday, which is not ending.
That's really cool. So you have endless throwback conversations and things to do. But you talked about the impact of the lockdown around the world on lives of entrepreneurs and work. Of course, you're not moving around as much, so you're not also spending too much. But it's always better to have inflows than have nothing at all, however small it trickles in. That creates a headache for you, as you said. How are you sharing the headache with Ekwa? Ekwa, do you have to deal with patients at work and come home and then hear about how by now this deal would have been closed and this amount of money would have been made and opportunity cost and all that?
Oh, no, I think he's trying to hide it from me because he knows that we are not in normal times and I'm having a headache at the workplace. But once he goes off for 5 minutes, I know it's work.
That's interesting. Now, so when you go to work, are you constantly watching to see, okay, do we have everything we need to deal with the load we have today? At what point do you sometimes feel, oh goodness, I'm probably going to have to fall on my own stash of protective equipment that you've bought?
Well, with the protective ones, they give we don't have enough. That's the truth. But luckily, because I have a husband who is forthcoming, he got me some of my own I can use. But in protecting yourself, you have to protect your colleagues, because you can't protect yourself alone and leave them. If anything, you are very close to them. They could still infect you. So him being proactive and getting me mine, I sometimes share with them. But because of the COVID thing, they are trying to cut down on staff. So for a shift, they don't have too many people on a shift. So that in case of an infection, there are not too many people for them to lose. So like today on my 12-hour shifts, there were just 2 of us. You can imagine. And we had our hands full with about 10 patients or more, I think. Yes. And as much as we are not getting enough, I for now have enough I can use. So it's not really a big deal for now. Yeah.
So on days where you go to work and you're super stretched, like 2 to 10 patients who have varying needs and would need you around the clock. When you've left the office and it's not been a great day at work, and and you're tired, how do you bottle up? How do you deal with the troubles of the day, whether it's disappointments, because you don't want to talk about negative stories when you come home? How are you able to bounce back and be ready for the next day?
It's really frustrating, but I come home and then I just take a bath and then come inside. Kwame doesn't stress me with work, like how home stuff. I came and then he had made his rice to eat and everything, so I'm okay. And then he was telling me we should watch a movie we were watching yesterday. We didn't finish. So in the middle of that, I could just sleep and then that's it. I'm fine. So I'm not really stressed in the house, and that helps.
That's interesting. So when you wake up in the morning and you have to go,
I take my bath and I'm gone.
You don't wake up and say, "Oh no, I'm gonna have to go and do this all over again today." Do you ever feel that way?
No, you don't even have the time to do that because I'm doing 8 to 8. So I'll probably wake up around 6:30 and I'm in a rush. So I'll take my bath, find something to wear. So on the road, and then I'm like, oh no, I'm going to face this again. No, it's frustrating. But once you get to work, the night shift is tight. So they're handing over to you. You don't have the time to process it. You don't have the time to. So it's like once you get to work, it's business as usual. And then in the middle of it, you get frustrated. I am very audible. So I shout and shout and shout and I continue. I'm like that, but work goes on.
Right. So you talked earlier about it being your calling, and from what you've said so far, it clearly is something that you're passionate about and do with a lot of ease.
Oh, there was a day I had a patient who was very bad and then they could do nothing. So before I left work, I was telling them that this case needs an ICU. I don't see her still being here. And then I go back in the night and then she was still there. And then she was going, her brain was going off. I had to suction, I had to do this. So I was doing everything I could for the patient. And then since I took up around 8 p.m., I was with her till 10. I wanted to take a water break. And then I went to get water from the fridge. In 2 minutes, the doctor calls me and says, your patient is gone.
Wow.
Yes, like that.
How did
and she was 18. It's frustrating. And I was on duty with rotation nurses and they were all afraid. So they left me alone with my patients to clean her up, to prepare the body for the morgue and everything. And looking at a young life, she had one child at 18 years and she just lost her life like that. And she was lying like, so as I was cleaning her up and then preparing the body, I wasn't even thinking of what I was doing. I was thinking of a lost life. And if we had an ICU, if we had things, maybe, just maybe, we could have saved her life. But she was gone. And she had left the child with no man and with nobody to care for the child. It was very sad. It was sickening, actually. There's at that point, you wish you had the resources to do more. There are sometimes you see cases where you think if I had more, then maybe they would have just survived. Or at that point, you know that you have exhausted everything and it didn't end well. At least you are happy. But for the ones that you know that there could have been something which could be done and then it wasn't, it breaks your heart. You come home and you ask yourself, what am I doing? Did I really choose this? Am I in this? But you wake up the next morning and then you are reminded that there are a lot more people to save. So you put on a brave face and then you move on. You move on.
Do you get any occupational therapy when things like this happen?
In our part of the world, I don't even think they think about us. Like, I had a doctor who lost a case in theater. Everything was normal. And then the patient was gone. And he was off. So the next morning, they were forcing him to the theater. And he was telling them that, look, I am not in my right state of mind. Then they tell him that, look, you can't say that. There's no one to do the job. So you have to go and do it. And so that day, I was very frustrated. I was like, you need to think about somebody's state, mental state. You cannot just ask him to go to the theater because he has to go. You need to calm him down. He had a patient where everything was fine and he just lost the patient. Don't you think he would think about it? He would try and analyze it in a way and think if it was his fault or something. But no, he had to go back to do it. So yeah, this is the kind of world we live in. They don't think about your mental state. All they think about is that we are short of staff and you need to do it. So you have to continue.
Is it possible that because we're short of staff, it's likely that there are fewer people who can provide the kind of psychosocial support that's required for you to bounce back and cushion some of these heartbreaks?
Don't you think that if you force a person whose mental stability is not really strong at that point, the person could make mistakes?
That's a factor to consider.
Exactly. So why
but
put
if that's
more
the only
people at
person,
risk?
but if that's the only person available, would you also say that because they may be pushing under 100%, I'd rather they don't try at all?
Why wouldn't you refer the case? Why wouldn't you find something else to do for the person than put the person's life in danger?
Okay, all right. So there are protocols that should help deal with some of these things.
Exactly.
So how do you fix yourself, Madam Fixer? You fix everyone.
For me, I rant. Kwame knows me. I will scream and yell and scream and scream and scream and scream. It makes me feel better. After I yell and yell and yell and yell, like I'll be fine.
You do that at work or you do it at home?
Why are you laughing?
do you do that at work or at home?
Well, at work, I can't do it in front of my patients. So I go inside, you ask me a question, I'm off, like with my colleagues. So yeah. I go inside, I take like a 5 minutes break and then yell and yell and yell and yell. So anyone who comes to me, I yell at you. So they leave me alone. Then I come and continue in the house because I can't do it in front of my patients.
So Kwame, on a day that you are completely oblivious to what kind of day she's had at work, and on the off chance you've decided, let me be a little romantic today, so maybe you set the table and then she walks in a bad mood, how do you get her back to normal? How do you factory reset her?
So I think luckily I'm a bit more empathetic, so I always, it's a habit to read her mood even before or she gets back, or on certain times she would text me that I'm just having a bad day at work or something. Sometimes in the middle of work we do communicate, so even before she comes home I would know sometimes if it was a good day or a bad day. Mm-hmm. But then the thing about it is, if you live in a situation like that, you always read the mood. So if she comes back and I go like, oh, hi. I go like, oh, you're welcome. Oh, well, how was today? The look on the face can tell me. Okay. So if it was a really bad day, I'll be like, you know what, just calm down. Tell me what happened. And sometimes just even sharing what happened alone, and then listening and saying, oh, so because of this and this and this, is this what happened? Oh, but where was X to help, or where was Y to help? Oh, they couldn't get an ambulance out on time. Oh, this is so sad. But don't worry. This is not the first time. So, so those are the kind of things. So it's basically putting myself in a sort of like a fellow staff member mood, if I should say. Mm-hmm. then because then at that time, all she wants is somebody who would be able to help her regurgitate the event,
Mm-hmm.
and sometimes even to know whether it is not her fault, because when I mean being with her all this time, I realized one thing: when they lose a patient, they take it personal. Or when a patient, sometimes she'll come back from work and she'll go like, "Oh, I have this patient and she's unresponsive, or she's unconscious, or she's in intensive care, or she's fitting. I just hope everything is all right." And then sometimes you see the anxiety building up the whole night. So then the best thing you do is, okay, you'd be like, okay, so do you want to call the ward and find out if everything is okay? The treatment that you started, do you want to call and check out? Because sometimes she'll be with you in the house, but her mind is on somebody who she thought was dying or is in a very bad state. So at that point, you can't make it all about, okay, you are home, so you think about the house. So sometimes you just got to help with the work that's being done. That, okay, don't you want to call and find out? So that at least it even sets her mind at ease before she goes to bed. So those are some of the kinds of things that you can do. And sometimes it even means doing a bit of research to look at something and then be like, oh, when the patient does this and this and this and this, these are some of the things that happen, so that she can prepare her mind for the next day, knowing that there's something a bit more predictable, so that even if it is bad news, she's more psyched to understand the outcomes of any bad thing that's going to happen. That way is better, and then she can handle it better, because I mean, these are things that happen on almost a daily basis. But then the emotional aspect is such that you have to be there and you have to listen. Like 95% of the time, you have to listen, and you at a certain point you build a skill on what questions to ask and what questions not to ask. So you can't even say, for example, it's your fault that this happened. You can't ever say that. But then what you can say is, oh, so did you try this and this and this, and nothing happened? It goes like, yes, there was nothing I could have done. I'm like, okay, well, if that's the case, let's just hope that tomorrow gets better. That kind of thing. So you become a bit of a motivational speaker in the process, but that's the only way to go about it, because the stakes are high. It's people's lives and people's health, and that's more different than if, let's say, she was selling toffees in town.
Kwame, it's interesting that you are an empath yourself, and so you know when to step in and help carry your share of the load. But has there ever been a time that you asked yourself, God, did I really sign up for this?
So she's I've the first time I met her at a hospital. So I think right from day one, I got to know that this is what I had signed up for. The thing about it is, there are times when she really breaks down completely. I mean, I remember there was this patient she had who had cancer. It was terminal, and it was a really very hard time for her, having to handle the patient and the family and all of that. It wasn't easy. And there are times when you see all of these things, and you see her come back from work and she's crying about somebody, and like, how could this person have died? And maybe all the person needed was this. There's a location, for example, where I go to sometimes I go to pick her up, right in my face, I see certain things, and then I'm about to I sometimes go like, okay, let me even use my own money to help the patient, because then you see people who don't have money or anything. So I think also one of the things is, because I take a very active part, everybody in her ward knows me. I sometimes go there, sometimes I even buy them a few goodies and stuff, just to keep everybody's spirits fine. So I am almost like a comrade of sorts. So I also like the fact that she's doing something that is helping people's lives.
Apart from the challenges you face going to work and back, what is it like interacting with the general public? Of course, you have to go out to buy things, maybe on your way from work and things like that. What has been the response from people when you meet them? Are they empathetic? Are they, grateful that you are stepping out to save lives?
Yeah, for me, I haven't had an encounter yet because even pre-COVID, I never wear my uniform anywhere. I try to protect myself and other people as much as possible. So I change at work and then change before coming back. But yesterday, a colleague of mine called crying that her hairdresser was home and then she went to her to help out with something on her hair. And this woman just started running away from her and then she infected her with the virus. She cried the whole day. Another colleague also was coming to work, and because we are not allowed to move around, she was in uniform and she was going to pick a taxi. There was a woman in the taxi who didn't allow the driver to pick her because she was a nurse, and then felt she had the virus and then we infected.
That could be very demoralizing, and
Oh yes.
evidently your friend cried because of that.
Yeah.
But what would you say to our audience to make them feel safe that in spite of going to the front line, think about it this way. If there was a world war and our soldiers went out to fight, when they came home on a furlough, we embrace them and celebrate.
Yes.
How do we get to the point where we see our soldiers in the front line as the nurses and the health professionals who are at the forefront of fighting COVID-19?
This is tough, but I think that for us, in as much as people are afraid, they should see that we also come from families. We don't want to infect anybody. For us, once we understand what we are dealing with, we, as much as possible, will not try to infect anyone knowingly. I think that if there's any nurse or any frontline worker who thinks they've come into contact with anyone, the first thing that comes to mind is to be quarantined. And it's happening in some of the hospitals where they have patients who are suspected cases. So they are quarantined along with whoever they think is suspected to have the case. So I don't think that somebody would knowingly infect you. So the only thing to do is just to keep to the precautions. Wash your hands, use your hand sanitizers, keep a distance away from the person, not necessarily stigmatizing the person and making the person feel that way. Because if we are feeling like this, we might not do our work well. Because if we want to do the same thing that is being done to us, then I don't think it will end well. You get where I'm coming from?
That's
so
right.
Even though we are not expecting hacks from people because of what we have, we expect that at least they trust us to do our job and that we'll do it well.
Let me just wrap up with this two final questions. One, okay, what has COVID-19 and social distancing done to intimacy in your home?
Nothing.
Sorry, I didn't get the response properly.
Nothing.
Is that nothing?
Yes, nothing.
Okay. Kwame, for you, what's your one hope in all this?
My sincere hope is that she goes to work and comes back safe every day. Her OCD levels have spiked up a bit. So if I go out, I'm supposed to remove my clothes outside and bath before I enter the bedroom.
Okay.
And she also, as a nurse, she does that. When she comes from work, she doesn't want to touch anyone, and she wants to go to the washroom or the bathroom first before changing, even if she baths there before she comes home.
Mm-hmm.
Only that now we have all become schoolboys because we have been told, we are shouted out at to wash our hands and bath more and be cleaner. So now she's the hygiene police in the house.
Okay, so senior house mistress and hygiene police.
Yeah.
And for you, your final question actually would be a double dose. The first part is, you've seen stuff that have broken your heart. I'm sure somewhere in your line of work over the years, you've seen at least one miracle. Can you recount something that for you was a miraculous day at work?
I see a lot of them actually, because there are some patients you give them no chance. Once you see them with experience, you are like, no, I don't think this one's going to be around. And yeah, I had one last week, no, 2 weeks ago. She came and then she had a very bad case and she didn't want to be touched. So they had to convince her. And then finally, it took about a week. And then the whole theater thing didn't go well. She was in the ward for like 2 weeks. And then she was reacting to drugs. So like everything about the case was bad. Everything about her was bad. And then at one point, she told my colleague that if she dies, she'll be better off because she'll be no more pain and then she'll be free. So we had to edge her on, counsel her, talk to her, be her friend. And then she was okay. And then one day I get to work and then she had absconded. She ran away without sending her medical bill.
Wow.
And I was like, okay, she's fine enough to run away. At least, thank God, she's not crying to die anymore.
Okay, well, that's a miracle with a twist. What's your hope?
Yes.
What's your biggest hope every day you wake up to go to work?
That we will get to the point where we have things to work with. We have more modern equipment used in taking care of people, so that when you go to work, you are not so frustrated and you are not so tired. Because when you have modern things, they help you to do your job, and then it's better because you don't have to kind of like break your back in doing every little thing. And it will also go a long way to help the client. So yeah, that's what I hope for every day.
Thank you for your dedication during these crazy times. And Kwame, I think you deserve a medal. You're like the frontliner. Keep it up.
She's my medal.
She's your medal. Fantastic. You do take care of yourselves. And thank you so much for making time.
Thank you.
You too.
You too. Take care. You've been listening to Simple Conversations with me and Shira Ado, and I hope our conversation helps you live a fuller life. Do join us again for the next episode.